have to extend condolences to one of the family members from Zone 9. We lost a bus operator yesterday, right? So, look, it's happening. It is happening.
That was President of the National Bus Association, Garth Woodruff, extending condolences to the family of the fallen Zone 9 bus operator. COVID-19 is now being labeled as Grenada's raging health wildfire, as it is raving almost every edge in its path, sparing no age or other demographic. Reports are that the virus has now claimed the lives of 38 individuals. Family, friends, and well-wishers of the deceased are now thrust into bereavement. The question is, when loss comes, how should we process our grief? In an effort to better understand the grieving process, many mental health experts and researchers have dedicated years to studying loss and the emotions that come with it. One of these experts was psychiatrist Elizabeth Kubler-Ross. In her 1969 book on death and dying, Kubler-Ross examined the 5 most common emotional reactions to loss, which include denial, anger, bargaining, depression, and acceptance. Experts say that these emotions are forward steps in the healing journey. Support from people has also been pointed out as a critical factor in the healing journey. Permanent Secretary for Hospital Services, Hannah St. Paul, says the Ministry of Health will provide psychosocial support for frontline workers and others in the community.
Because at this time, we realize that psychosocial support is a critical aspect, not only for our patients in allowing them to accept the disease and the disease pattern, but also our health team, family, friends, and the community as well. So our action plan for psychosocial support, partnering with the Ministry of Health, has been activated, providing the support to persons who have been tested positive and also to our health team that is out there in the field, providing the testing services and all that is needed, having to go through the process of witnessing death day in, day out.
As the coronavirus continues to cause deaths and disrupt billions of lives globally, people may turn to religious groups for support in dealing with global disaster. Reverend Benedict Newton, a pharmacist by profession, gave his prescription to help quiet the internal disquiet being experienced by many.
A prescription for mental, emotional, and spiritual health and well-being. It's recorded in the scriptures, Philippians chapter 4, from verse 4 to 9, in summary. He's saying to us, the apostle is saying to us, don't worry about anything. Instead, pray about everything. Tell God what you need and thank him for all he has done. Then you will experience God's peace, which exceeds anything we can understand.
Meanwhile, the government of Grenada has declared September 25th and 26th as national days for spiritual reflection in recognition of the critical role of spirituality in dealing with the impact of the COVID-19 pandemic. All Grenadians, including those in the diaspora, are encouraged to go before God as a nation in reflection and prayer during the designated days of spiritual reflection. Krista Campbell, GBN Health.